Hello, everybody. Thanks for coming to listen to me this afternoon. Probably because it's warm in here as opposed to out here outside, but it is definitely warmer. I'm going to enjoy being under the lights. So, yeah, thank you very much for coming to listen. I'm just going to touch on today sustainability and a greener NHS and how we make that happen and why it's absolutely imperative to happen. So don't worry, I'm not going to give you another 30 minutes on net carbon and how we get there. I'm going to do a lot of case studies and a lot of hopefully interesting NHS facts for you. So just to start with a bit of an introduction, I joined the NHS officially after UKHSA and Test and Trace on the 1st of January as the Chief Commercial Officer. It's a role I'm really honoured to be in. It's an incredibly privileged role and it's an incredibly complex position. So the NHS, we've got about 35 billion of addressable spend. We've got over 4,000 people in the NHS buying things, over 300 commercial teams in a very complex environment. So we have the trusts buying, we have Crown Commercial Services buying for us, we have the NHS supply chain, we buy things on a national level. It's very, very complicated setup. So absolutely, I knew when I was asked to take up this challenge, it was definitely something that I wanted to do. So I've got a lot of things that are really important to me that I'm focused on. Clearly, value for the taxpayer, transparency in everything that we do in the NHS. You're all feeling it right now because your pay slips probably reflected that your national insurance has gone up, and we all know that's going into health. And yes, me and my team are responsible for how we spend that, of course, along with the clinicians and how we improve health. So very, very aware of the scrutiny and the transparency that we have to do. So I have a lot of things that I'm really focused on, but absolutely sustainability, social value and net zero needs to be one of my top priorities. It's been interesting. I've heard a couple of people talk today about how it sort of went a bit off the radar during the last pandemic. And I think if anyone can attest to that, the NHS can to a certain extent. But it didn't go off our radar at all in terms of completely. Even whilst we were in a pandemic and we were buying what we needed to buy, we kept our net zero and our social value agenda very much at the forefront and tried to ensure that we were buying things in the right way and in a sustainable fashion. I heard someone earlier mention the lateral flow devices, which I was responsible for procuring for the country, and actually making sure that what they were made out of and the sustainability was something very important, even in that time of crisis. So what I'm going to talk about today is asking the question, can we improve patient care if we don't tackle climate change? And so when I'm talking about sustainability today, I'm going to focus on a couple of things. Yes, it is working with our suppliers to get to net zero. It is increasing that, driving that increase in value spend through the social value and the weighting that the government has now imposed on the 10% weighting on all government spending. And I'm not going to touch on it too much today, but there's a very big agenda around modern slavery, genocide, etc., that you've just seen recently has gone through the House of Commons. So very, very big part of our agenda. Okay, so, you know, tackling climate change. I think it's actually one of the biggest health issues we all face at the moment. So it really isn't a problem for the future, it's a problem right now. And I want to share some stats with you. So the heat waves of 2020 claimed more than 2,500 lives. We were able to attribute 2,500 life loss just to the heat. So we've had 9 of the hottest years on record have occurred in the last 10. It's all very pleasant when it feels so cold today, but it's a real serious health issue as we're finding the change in the climate. Air pollution is still one of the greatest environmental threats to human health in the UK, and it actually accounts for 1 in 20 deaths. I think that's quite a shocking stat, actually, that we can literally, through the patient pathways, we can put back somewhere along the line to air pollution. So the high air pollution, you know, it triggers things like asthma attacks, definitely worse symptoms for people who are already having respiratory and trouble breathing. So By reducing emissions, just that alone, we have the facts and the data. We will have fewer cases of asthma. We can actually link it to fewer cases of cancer, fewer cases of heart disease, fewer cases of respiratory. So for us in the NHS, this is why it's really, really important. It's not just a government thing or it's a nice to have. We actually know it's going to result in patient care and patient outcomes. And the NHS, we're in a really unique position. So we are we are Europe's largest employer. We've got 1.3 million staff who work in the NHS with over 80,000 suppliers. So now you can see the size and the scale of the opportunity. But of course, with that size and scale comes the fact that we're responsible for 5% of the UK's emissions. That's a lot on one organisation, 5% just in the NHS. And when you look at our NHS carbon footprint as it stands today, it actually equates the total emissions of smaller countries such as Denmark and Croatia. So really, really important that we put some focus on this. And over 60% of those emissions I'm talking about sit within our supply chain. They sit within our areas such as medicines, medical devices, freight transport, food, catering, business services, construction, manufacturing. We've got it all. We've got every single category you can possibly imagine in the NHS. So why is the supply chain so important to helping us achieve what we need to do? Well, the NHS, we've been a leader in sustainability. This is the good news for a long time. It was 2010 that we first came out and said we're going to focus on cutting emissions. And I'm really proud to say we've done 30% reduction since 2010. In October 2020, so recently, we were very, very bold in becoming the first health service in the world to commit to reaching net zero carbon. So at that stage, no other health service said they were going to do that. And we've set these targets of net zero by 2040 for direct and by 2045 for indirect emissions. And just to make the point, it's not just the NHS. Those of you that are already contracting with other government departments across HMG will be really, really well aware that we are doing this across the entire government. And we are bringing in certain rules. I'm not going to go into the policies and the regulations today because it's, well, you don't want to hear me start quoting PPNs, etc. But you would all have seen it if you're working into government, the social value 10% that we've imposed on all of our procurements going forward. So I thought what would be really interesting is to run through some business cases. What does this mean? What are we actually doing? Because it's easy to stand here and say we will be net zero carbon, but what are we actually doing? So I thought I'd take you through some. So first of all, talk about the travel and transport. This is massive, massive within the NHS. And the travel and transport makes up 14% the emissions of the carbon footprint. So we've got an estimated, I love this fact, so I've got my prompt cards because I've got a lot of facts here. 6.7 billion road miles each year are used from patients and visitors travelling to and from NHS sites. It's an awful lot. So, for example, if you had better use of technology and we learnt from what we've done in the pandemic and we start doing more virtual consultations, for example, so you don't have to go to your primary care provider all the time. You don't have to go to your GP. It's looking at initiatives like that. How do we stop people having to physically, where they don't need to, go into a primary care or a secondary care site? There could be up to 30 million outpatient appointments that we can actually reduce by putting the right technology in. We've done a lot of work with the ambulance service. Really, really proud. The London Ambulance Service is investing 16 million. We put 16 million into electric response fleet. And it's now the greenest fleet of anywhere in the country. And we're going to continue with these initiatives. So there is a lot we can do around travel and transport within the NHS. So I'm going to move on to medicines and medical equipment. Again, 25% of our carbon footprint is through the medicines that we buy and the medical equipment we use. So we thought long and hard about this, and our approach has got to be patient-centred. So to have a green treatment or the greenest treatment, it's got to be one that ultimately keeps the patient out of hospital. So by either compromising or going green or going net carbon free, etc., on medicines and devices that doesn't give the right patient outcome is not something we're going to do. So we have to look at the entire patient pathway when we're bringing in these new innovative and creative ideas. Couple of examples in Bristol and London, and I've been speaking to the clinicians in these trusts. We're moving away from using carbon-intensive anaesthetic gases, which is absolutely, I really enjoy it. It's absolutely brilliant. When I go into a hospital and I have a group of anaesthetists who want to talk to me, and I do like getting in scrubs, I have to be honest with you. Very comfortable, especially wearing Crocs. But anyway, yeah, better than these. They're standing there and they're passionate. They say, we've been, putting people to sleep for surgical procedures through these gases for X amount of years. And now we, as in the clinicians have been driving that, have come up with a different way of doing it, whether it be through IV or through different, more sustainable gases. And so that really gives me a lot of hope that it's not just commercial, or it's not just the finance team, or it's not just the teams of specialised people that are doing, sustainability. It's actually coming from the doctors, it's coming from the surgeons, it's coming from the nurses, it's coming from the porters, it's coming from the people that are doing the food every day, and a lot of those obviously are provided by suppliers. So I'm seeing it all through the NHS, which is really exciting. And I love this last fact again. Using gases is really, really quite bad, using gases for treatment. And, the delivery of our first baby girl last year that had a climate-friendly pain relief is something we're quite proud about. Don't ask me the details on it. I'm not a clinician. But we did it, and we're now starting to roll that out through a lot more hospitals. And I believe that it's just as good for mum, which as a mother of 2 children can attest that's very important. So let's talk about our estate and our healthcare facilities. Oh, one of the other jobs I've also got is I'm responsible for estate and infrastructure across the NHS. And that is vast. We've got 8,500 hospitals. We do 266 meals every minute across the estate. We clean, I love these facts, the size of Gibraltar 4 times a week in our hospitals. Priya mentioned it in our panel earlier. We've got more people sleeping in our beds overnight than there are hospital rooms in the whole of London. So this is a very, very vast estate. And there has to be massive opportunities for us to do sustainable and social value work in our estate. As I said, up to 15%. So I could do a whole presentation of what we're doing in the estates and infrastructure environment, but I just thought I'd call out a couple. So Milton Keynes, the solar panels, I believe that's the picture you've got there, on the roof of the hospital. 15% of the total electricity that the hospital uses. That's quite good, but it's going to save the trust over 225,000 a year in energy bills. That's a lot of money just suddenly there from 15% saving on your hospital bills. So we're looking at obviously expanding that and making more. But the great thing is also the solar panels. We've actually linked them in, so now they run the CT scanners, they run the MRI machines, these bits of equipment that most hospitals have got that actually take up a significant amount of energy. Hull, a hospital in Hull has just installed 11,000 panels across 8 acres. It costs 4.5 million, but again, you have to invest to therefore reap the benefits further down. And that new solar field is going to be providing the whole entire hospital site with its energy. And just some other areas, we've got a new healthcare centre in Coventry we've just set up, and we've made it a smart building. Again, I could talk for a long time on smart buildings. I'm absolutely passionate about it. And the new hospital programme that we're putting in place, and we'll be announcing another 8 new hospitals very shortly, they're all going to be smart buildings. They have to be. Absolutely. And what I mean by smart buildings, you know, sensors monitoring the building's energy, water, temperature, air quality, the way that we insulate the buildings, the way that we ensure that the buildings are digitally enabled for where we want to go in the future, not only with equipment, but also with sort of the technology that we want to run. And this particular building, this new health centre, it's a quarter of the energy of other health centres of its size. So we know we can do it, we know how to do it. So innovation, this is absolutely, how else are we all going to drive low carbon options and develop the market further if it's not through innovation? We've got lots of examples of suppliers that we're working with, and usually it's the SME suppliers. I've found this all through my career. It's the smaller, more niche boutique companies that are the ones that come up with these brilliant ideas or these brilliant innovations that we can then implement throughout the NHS. A couple of examples in UCLH, we've just got a new portable breathing system which reduces the use of Entonox. Again, that's the anaesthetic gas that's used during labour and pain relief. Just by doing this, it's, you know, as I said, those anaesthetic gases are 2% of the NHS emissions. We've got to go after that. We've got to go after certain categories that really are causing quite a lot of the high emissions. We're going after things like new surgical textiles, such as drapes and things in PPE, which have got a low carbon footprint. We buy a lot of stuff. We buy a lot of devices, we buy a lot of equipment, and we need to make sure that we're being very deliberate now about buying the right equipment that meets the criteria that we need. And I've been to, as I say, I've been going all around the trusts, all around the country. One of the things I always ask for, what are you doing? What are you doing in this trust? What's innovative? And without a doubt, everywhere I go, I'm quite blown away actually by just the level of innovation that the NHS does. I was in Leeds a little while ago, and just reusable, it's a particular valve on a catheter, which we didn't do before, always got thrown away. So the more we can start reusing these products, the better, in obviously a safe clinical environment. So I always say the NHS is a very, very innovative organisation anyway. It's about patient care, it's about healthcare. So of course, innovation has always been right at the forefront. You see that, you know, where we were a year ago, where we were 5 years ago, whether it be mental health, whether it be cancer pathways, whether it be cardio pathways. It's something very natural to us. And so now it's starting to use that innovation, not just for the patient care pathway, but also in a way of sustainability. So I do need to talk about net zero, because it's really, really important in terms of what we've done. And I think what's really important here is a lot of people talk about it, oh, we've got to get to net zero, or, you know, these are our targets, but you've got to be very, very deliberate, and you have to put it out there what it means, and you've got to follow that through. And for us in the NHS, you know, we've put out some very, very clear dates, timescales, and objectives for our suppliers. And, you know, this is going to be quite tough. We've got to work on we've got to go on the journey with a lot of our suppliers. So it's absolutely embedded into everything we do. And from April 23 and beyond, all our suppliers must publish their carbon reduction plans. That's quite a big ask. From April 23, if your contract value is over 5 million, your carbon reduction plan also has to cover direct emissions. And then from April 24, that will then go out to all of the NHS suppliers irrespective of contract value. We are, however, getting back to SMEs, granting a 2-year grace period so that the key milestones for SMEs, voluntary, community, social enterprises, have more time and we can work hand in hand with them. So what we didn't want to do by putting out this carbon footprint is make it really, really difficult suppliers to work with us without us giving support and backing and working alongside. But we've been very, very vocal about this, and I think that's one of the sort of the key things I want to get across today. If you're going to do it, you've got to do it. And you've got to be quite deliberate about it, and you've got to give people time to be able to adapt. You've got to be able to explain what you mean by what you're asking, and you've got to work with your suppliers through the journey. So, in conclusion, because I want to leave a lot of time for questions. I tend to find there's a lot of questions when you talk on behalf of the NHS. Can we improve patient care if we don't tackle climate change? No, we can't, because of the reasons I've given you already. It's absolutely linked. A healthy person is, you know, as a result of sustainability, reducing emissions right across the UK. We do need our suppliers to work with us on this. We can't do it alone. We don't wish to do it alone. So there's going to be a big focus, even more focus now, on that collaboration and that co-creation. You know, we say it's about our health now. You know, our future generations rely on this. If it's not me and the people that I work with, yeah, who is going to push this agenda? We've got to do this. And so just a couple of the key things I always say. You've got to be deliberate. I hear that a lot today. You've got to be deliberate about this. You've got to be very, very focused. You've got to make sure you get everybody on board. And that, you know, for me, that's a really complex environment. It's not only the NHS board and the NHS Exco who are completely behind this with me anyway, but it is the clinicians. It is the public. It is the suppliers. I need everybody to understand the journey we're on and be part of that journey. Need to have a burning platform. I often find when I speak to suppliers and companies, it's kind of, well, why are you doing this? Because we have to. No. There's usually a burning platform. My burning platform is really, really clear. It's about patient outcome. It's about making sure that people are healthy. So that's an easy burning platform. And then, you know, my final comment is, you know, make sure you shout about it. You know, I will go out, myself and my colleagues will speak about this a lot. You'll see it out in the public. Yeah, everything we do in the NHS is in the news, every single thing. Without fail, every night I'm watching the news and I'm like, oh yeah, that's one of mine, or that's something I'm doing, or that's something we're dealing with. Well, we want you know, the media and everyone else to start picking up what we're doing around sustainability and social value. So I'd love to have some dialogue with you now. I wanted to particularly make sure that we had time for questions because there's so many different areas. It's such a wide topic. So thank you very much for listening and open to questions.
Okay, if anyone does have any questions, please put your hand up and we can get a microphone over to you. But I've had lots of questions that have come in, as expected.
Yeah.
Now, to start with, let's just deconstruct some of that, because you threw out some huge stats there. For instance, Europe's largest employer, 5% UK emissions. And in an earlier session, we were saying there are more beds in the NHS than there are hotel beds in the whole of London. We forget what a huge organisation the NHS is, don't we?
Absolutely. Huge and very, very complex. And that is part of the challenge here, because it is complex. It is run by a series of trusts. You all know what your local trust is. But one of the things we're doing around that to address that complexity is on the 1st of July, we're actually officially launching our integrated care systems. So what that is all of the trusts will now go into 42 ICSs, integrated care systems. So what's really good for me is, and tomorrow I'm spending the day with the rest of the Exco and all the new chief executives of those ICSs and the chairs of those boards that cover all the trusts. So rather than have to go out to sort of like 200 plus trusts, we can now focus in on a much smaller group that therefore has the responsibility for that whole environment. And that's the key thing. It's the NHS often is accused of working in its separate trusts, separate areas, a bit siloed. Are you all really talking to each other? So we're very, very focused, and driving the social value is something we're doing centrally right across the trust. So yeah, it is. It can be a bit daunting in terms of the size and the scale, but we've got really, really clear pathways about how we execute things.
Okay, and I do want to crack through as many of these questions as we can. Sort of relating to that, there's one here that says, would you prefer to work with 10 SME suppliers with innovative ideas or one large supplier as a one-stop shop?
Yeah, really good question. Because it is difficult. It is difficult knowing how to work with the NHS if you're a small supplier. It's actually really difficult if you're a small supplier anywhere in government. That's the feedback I've constantly had since I joined government many years ago. So we're trying to be very, very deliberate about that, and we're making sure we've got very, very clear pathways for SMEs to come in and work with us. Again, if you are an SME and you're not sure where that is, let me know. I'll make sure we send you the right government links, the right NHS links of how you can actually come in there. But to answer your question, I think there is space for both, quite frankly. I think we can absolutely work with smaller organisations. Often with small SMEs, it's about size and scale, and it's about whether they can scale up to actually deliver to the NHS. So we have to work with SMEs in a slightly different way. So, for example, often an SME, it will be a group of scientists that have come up with a particular widget. And they'll come to me and I'll say, the clinicians will look at that and go, this is absolutely brilliant, we want to do that. But that small company wouldn't necessarily be able to manufacture the size and the scale we need, wouldn't necessarily, might not have the understanding of how they would roll it out across a 1.3 million organisation. So that's when we encourage a lot of partnership. That partnership, that collaboration, that co-creation, and quite often ask our SMEs to work with our bigger, larger suppliers. When we get those relationships right, we get those partnerships right, anything's achievable, because often, as I say, it's hard for an SME to do it on itself. But that's why we've got very deliberate pathways. That's why we're here my commercial team, right across the NHS, to help those SMEs to navigate that.
Okay, we've only really got time for one more question, and this is relating to sustainability. It says, I'll say who it's from Nick Carding. It says, NHS trusts and ICSs had to submit green plans to NHSE's Greener NHS team by April 2022. What's the quality of those plans like, and what happens next?
Yeah, really good question. So I haven't read those plans, started on the 1st of January, my team have. And just calling it out. I'm not going to say I've read them all and they're absolutely brilliant. I think where we are with that now is the understanding that there is a real difference of understanding, capability, capacity, maturity when you look across the trusts. So some of the trusts, absolutely, and I have seen some of them, have got this, right? They know exactly what they're doing. They understand what the government's asking. They understand what NHS England is asking, and they're absolutely leagues ahead. And there are other trusts that clearly are struggling. And that's one of the really interesting complexities about the NHS. Not everybody is equal. I mean, they are all equal in terms of giving patient care, but not all necessarily equal in terms of, as I said, the understanding and having the right people in place. So one of the things that's really important for us is to make sure that we bring up that skill set, make sure that those trusts that need that extra intervention and that extra support, we're giving it to them. Make sure that those trusts that really understand what their greener NHS plans are, because they're absolutely they're leagues ahead. Let's start buddying them up with the trust that needs some help. So that's how we're dealing with that. And it's not a one-off. It's not a you submit your plans and we're never going to, thank you very much, tick box exercise. This is a constant, ongoing, living collaboration.
Okay, and as you said, there's always loads of questions when you get on stage and talk about the NHS. We've had more questions come in than any other session so far today. We simply haven't got time to address them, I'm afraid. But we'll try and get those questions to Jacqui, so you and your team can